Today we are going to talk about chest physical therapy techniques. Please discuss it with your doctor before trying this at home. There are certain conditions such as blood clots in the lung where this is not appropriate. We are using our hands and make them hollow shape like this. Maintain a steady beat and hollow sound and a lot of wrist motion as you do it. Keep your arm relaxed. Do not perform the percussion technique over the breastbone, over lower edges of the rib cage, and over the spine. First, I'm going to show you how to do percussion over the upper part of the chest. So you'll be cupping your hands and only using the wrist motion. We are going to make the steady hollow sound. It should be done above the nipples on the upper part of the chest. Initially, you can do this for 1 to 2 minutes for each session. Next step, patient will be lying on his left side. You'll bring the arm up over the head, like that. Knees can be bent for comfort. Then you're going to turn the patient slightly towards you and cup or clap below the nipple. Do this for 1 to 2 minutes. Then after that, you will be turning the patient slightly over and do it a little bit behind on the back in the same area. So it's slightly below the nipple. Do this for another minute or 2. Next step, the patient will be lying on the right side. Bring the right arm up, knees bent for comfort. Then turn the patient slightly towards you, and the cupping motion will be performed just below the nipple line. Do this for 1 to 2 minutes. Then turn the patient a little bit over and do it slightly in front in the same area. Do this for another minute or 2. Next step, your patient will be lying on the stomach. This may not be possible in all the patients. Put a few pillows under the patient's stomach. So there will be a slope from the buttock to the head. You will be doing the percussion technique on the lower half of the rib cage. You want to stay away from the bottom of the rib cage. Perform this technique for 1 to 2 minutes. After the percussion technique, have the patient sit up at the edge of the bed and have the patient cough a few times. During the technique, if somebody wants to cough, then the patient can sit up. You should stop the technique, have the patient sit up again, cough, and then continue again. It is very important that if the patient is infectious, you should be wearing your PPE and the patient should be appropriately masked. Thank you very much for watching, and if you find it useful, please share it with your friends and family.